Rabies is a serious disease that affects both animals and humans. It primarily targets the brain and nervous system and can be deadly if not treated promptly. Rabies is caused by a virus that spreads through the saliva of infected animals, typically via bites. The virus is present in the saliva of infected animals and can enter the body through a bite or even a scratch. Once inside the body, the virus travels through the nerves to reach the brain. This journey can take anywhere from a few weeks to several months, depending on the location of the bite. When the virus finally reaches the brain, it causes severe inflammation and damage. Without timely medical intervention, rabies is almost always fatal, making it a very dangerous disease. That's why it's crucial to seek medical help immediately if you suspect you've been exposed to rabies. Rabies spreads through saliva. An infected animal bites another animal or a human. The virus enters the body through the bite wound. Wild animals are the most common carriers of rabies. Bats, raccoons, skunks, and foxes are high-risk animals. Domestic animals like dogs and cats can also get rabies. It's important to vaccinate your pets against rabies. Avoid contact with wild animals. Do not approach or feed them. Teach children about rabies and how to stay safe. Rabies symptoms vary. Early symptoms are flu-like. Fever, headache, and muscle aches are common. As the disease progresses, neurological symptoms appear. Confusion, agitation, and hallucinations can occur. There are two types of rabies, furious and paralytic. Furious rabies causes aggression and hydrophobia or fear of water. Paralytic rabies causes muscle weakness and paralysis. If you experience any unusual symptoms after an animal bite, seek medical attention immediately. Early diagnosis and treatment are crucial. Section 4. Facing the reality, diagnosis and treatment of rabies. Diagnosing rabies is challenging in the early stages. Symptoms often mimic those of other common illnesses, such as the flu or a cold, making it difficult to identify without specific tests. Lab tests on brain tissue are needed for confirmation. These tests are usually conducted post-mortem as they require a sample of the brain tissue to detect the presence of the rabies virus. Once symptoms appear, treatment options are limited. The disease progresses rapidly and the chances of survival decrease significantly. No cure exists for rabies at this stage. The focus shifts to palliative care, aiming to make the patient as comfortable as possible during the progression of the disease. Treatment focuses on managing symptoms and providing comfort. This includes pain management, hydration, and addressing any secondary infections that may arise. If you've been exposed to rabies, immediate treatment is essential. Time is of the essence, and prompt action can save lives. This includes thoroughly cleaning the wound and receiving a series of vaccinations called post-exposure prophylaxis, or PIP. PEP involves a series of shots that help the body fight off the virus. PEP is highly effective in preventing rabies if administered promptly. The sooner the treatment begins, the better the chances of preventing the virus from taking hold. It works by boosting the body's immunity against the virus, providing a crucial defense mechanism. With timely intervention, rabies can be prevented, allowing individuals to return to their normal lives. Section 5. Prevention is key. Protecting yourself and your loved ones. Preventing rabies is crucial. Rabies is a deadly virus that can affect both humans and animals, making it essential to take preventive measures seriously. Vaccinating pets is the first line of defense. Keep their vaccinations up to date. Regular vet visits ensure your pets are protected and healthy. Avoid contact with wild animals. They can carry the rabies virus without showing any signs of illness. Do not handle or feed them. Feeding wildlife can encourage them to come closer, increasing the risk of bites. Report any stray or sick animals to animal control. They are trained to handle potentially dangerous animals safely. If you are bitten by an animal, wash the wound thoroughly with soap and water. Seek medical attention immediately. Early treatment can prevent the virus from spreading. Educate yourself and your family about rabies. Understanding the risks and symptoms can help you act quickly in case of an emergency. Knowledge is power when it comes to preventing this deadly disease. Stay informed and stay safe.